Okay, Jake, you just explain the scenario and then if you describe the first aid treatment and the first aid and common treatment you do for the 4 different injuries.
Okay, well the first scenario is Michael Owen, who's a footballer, and I'm going to talk about when he ruptured his ACL. This injury is an acute injury because the pain is very sudden. This injury also happened on the football pitch when Owen received the ball off one of his colleagues and his foot stayed planted in the ground. He turned the top of his body, like his whole body weight, like his core of his body, and his knee just gave way, like twisted inwards. Like as I said, the foot stayed planted in the foot plate, the foot stayed planted in the ground. The symptoms that Owen was on the floor in agony, couldn't really move. The symptoms also for this sort of injury is swelling of the knee. You'll feel very unstable and the knee will feel as if it wants to slip back. So obviously it's not stable. The first aid treatment that I would give for this injury is keep the patient comfortable and stable. Apply ice and pressure to reduce the swelling and ease the pain. Also elevate the knee, give patient painkillers while waiting for paramedics or professional to come along. Common treatments, once you're in a safe position, is price, which is pressure, rest, ice, compression and elevation. Pressure is to reduce the swelling. Rest is just to give it time to heal. Ice is to reduce the swelling and keep the blood flow away from the injured joint so it don't fill with blood. Compression, just to reduce swelling as well, and elevation, that's to make sure the blood runs from that limb back to the core of your body.
Good. How would you elevate his knee? How would you get him elevated?
Like lying on a sofa or like on a bed or whatever, and then just lying on his back and then just like a few pillars or something like that. You just got to make sure no harm is done. Heat, another thing is heat should be avoided because this has not got as an effect as price. Heat will encourage blood flow to the knee, which will speed up swelling. No alcoholic drinks because this can increase bleeding and swelling and decrease healing. Running or any other physical activity should not be undertaken because this will aggravate the injury and make it worse. It also says that massaging the injury when it's just happened is another bad thing because that can increase swelling and bleeding, but after 72 hours a slight massage to the knee can be soothing and ease the pain also.
Good.
So I'm going on to my second one.
Yeah, second, can you explain what the second injury was?
The second scenario was Serena Williams, who was a tennis player, and she had a shoulder strain. I've noted that this injury could be both acute and chronic because it could be acute because you could play a stroke and you could strain it just from that one stroke, and you could overstretch or try and play it too hard or not in the right technique. So that's how I said it could be acute and also be chronic because Serena plays a lot because she's a professional and high intensity and is constantly playing shots after shots. So I said this injury could happen over a long period of time, but it could just go, like just keep on just getting worse, like progressively worse all the time. This injury happens when because you use your shoulder in every single shot that you play, so you're just putting a lot of strain on this joint. In Serena's case, her training is very intense and she's working at high intensity, so I said this injury is very common to her. Signs and symptoms of a shoulder strain could be swelling, bruising or redness, pain at rest, pain when a specific muscle or the joint is used, weakness of the muscle or tendons, inability to use the muscle at all. First aid treatment, I've said again, is the Price Act. So, I've got P is just protection. This simply just means protecting yourself from serious injury or making the injury worse. So just stop playing the activity. R for rest, stop playing the activity so you don't fight through the pain because you can make it even worse or could cause a serious injury than it already is. and allow enough time for the injury to heal before playing the sport again. Apply an ice pack to the injured area to reduce pain and swelling. Compression. Apply compression to the injured area, and you could use a bandage if required. This will help reduce swelling also. And elevation, just like I said before, just elevate the injured limb above the heart just to reduce the blood flow, to reduce swelling. Common treatments I've noted are just pretty much the same as the Price Act, so same as first aid I would use for the common treatments.
Good. Great. If you want to move on to the third injury.
Third scenario is Terry Butcher, who's a football player, and he sustained a head injury. I said this injury isn't acute because the pain, signs and symptoms are very sudden. This injury happened from a collision of heads, and they resulted in a big gash on his head that poured blood. The signs of this injury will be blood pouring down his head and face. Also, symptoms could be feeling dizzy or faint. Symptoms of a head injury can occur straight away, or symptoms develop slowly over several hours or days. Even if the skull is not fractured, the brain can still bang against the inside of the skull and bruise. The head may look fine, but problems could result from bleeding or swelling inside the skull. First aid treatment. Simple first aid treatment for this kind of injury would ask the patient to rest where they are, apply an ice pack or something cold to the injured part of the head with pressure to reduce swelling and ease the pain.
Good.
This will reduce swelling, like I just said, this will reduce swelling and ease the pain. If they begin to feel drowsy or begin to vomit, then that's when you seek professionals help, like call 999 for a paramedic or take them to hospital to get checked out. In serious head traumas, I'd say keep the person still until medical help arrives. Keep the head and shoulders slightly elevated. Don't move the person unless it's necessary. Avoid moving the person's neck. And if he's wearing a helmet in a sport, don't remove the helmet. Just leave it on. Stop any bleeding. Apply firm pressure to the wound with a clean cloth. Don't apply direct pressure to the wound if you suspect a skull fracture. Watching changes for breathing and alertness. If the person shows no signs of circulation or consciousness, breathing, coughing or movement, then begin CPR. Good. or seek medical advice.
Good.
Common treatments for this head injuries could simply be just checking for consciousness of the patient, looking for anything that could cause harm and removing it, or removing it from the area. Stop any bleeding if needed by applying and apply an ice pack with pressure. Basically just keep the patient stable until the paramedics arrive and take over from you and do what they need to do.
Good. What do you want to do at the hospital if you've got a big head cut?
Clean the wound.
Good.
If you suspect it's broke, take him for an X-ray, then strap it up.
Yeah. What might it need? If it's a big cut on his head, what might it need?
It might have stitches.
Excellent. You start on the final one, fourth one.
My fourth scenario is Beth Tweddle, who's a gymnast, and I'm going to talk about shin splints. I've said this injury is a chronic injury because it happens over a long period of time from excessive training, and from the excessive training that Beth does, and also the intensity of training over a long period of time. This injury also occurs from landing firmly on her feet, which puts pressure on her shin and causes these shin splints. Signs and symptoms of shin splints are sharp pain in the lower region of the leg, which also known as the tibia, and this can cause discomfort and pain when beginning to work out and reoccur towards the end of a session or training. First aid treatment for shin splints I've put is the Price Act again, which is just 5 simple steps. P for protection, just protect yourself from injury. Don't let them carry on if they're experiencing it, because it could make the injury worse than it already is. Just tell them, just sit them down, keep them resting, just stop them playing activity. Like I said, because this could cause serious injury than it already is. If they need it, get an ice pack and apply it to the injured area to reduce pain and inflammation with compression to stop inflammation, swelling,
Good.
and just elevate the leg, higher than the heart, like I said before, lying down with a couple of pillows underneath it, or something like that.
Good.
Common treatments is to stop the activity that causes the shin splints for at least 2 weeks, wait for the pain to ease away, and start lightly in the activity. Don't just go straight back in both feet. And also you could take part in some low impact activities while you are injured or while you're getting back, which could be like cross training or swimming.
Good.
Or cycling, something like that. And then just a few simple steps in common treatment are just rest your body, ice your shin or the painful part of your body or your leg, anti-inflammatory painkillers, arch. Also you could buy some arch supports for your shoes, which just give a bit more stability when you're walking or when you're landing or etc. Just a range of motions and move exercises while you are injured, just to keep your muscle in your joints just a bit, not so they don't seat up. And also neoprene sleeves for your shins to keep pressure on your shins all the time when you are doing activity, just to reduce the swelling. And just physical therapy to strengthen the muscles in your shin, so you could go physio if you think it is bad. You could have physio sessions.
Excellent. Well done, Jake. Good detail, good information. Well done.